With the big debate over health care reform underway now in Washington, a big meeting on the subject of the White House tomorrow, there's a place where policymakers could look for some tips on how an affordable, well-run system operates. It is already running here in the U.S. Our report on it tonight from our chief science correspondent, Robert Bazell.
When Dr. Sadia Griffith-Howard, an infectious disease specialist, sees patients at a Kaiser Permanente clinic, she does not worry about insurance payments or whether she has enough appointments to pay the rent.
This gave me a chance to really concentrating on taking care of patients and not necessarily worrying about the business side of medicine.
I'm getting a call on a station.
Many experts agree that whatever happens in the health reform debate, a good model is Kaiser Permanente, a system where already 14,000 physicians in a giant group practice care for some 8.6 million Americans.
Patients aren't waiting for a perfect health care financing plan. Their needs are pretty simple. They want affordable access to safe care.
Sir, we're going to give you some more medicine.
Affordable is the key. Almost everyone agrees on the need to reduce costs. Because they work for a salary, Kaiser doctors have no incentive to order unnecessary tests or office visits.
I'm able to take care of patients in the way I feel is the most appropriate.
The system was formed in the 1930s when industrialist Henry Kaiser hired doctors to care for workers and their families at the Grand Coulee Dam in Washington. At first, the AMA was appalled at the idea of salaried physicians. Dr. Cecil Cutting was one of the first Kaiser doctors.
They thought we were some kind of a communist plot.
But that attitude has changed. The AMA fully supports the Kaiser model. Extensive electronic medical records are also a part of Kaiser's cost savings, even allowing patients to make appointments, email their doctors, and see their test results online. To be sure, patients sometimes complain about Kaiser, but it gets decent ratings in consumer surveys and tends to be one of the less expensive options when people get to choose health plans. Robert Bazell, NBC News, Upper Marlboro, Maryland.